Now that we know what the normal anatomy of the mandible looks like from all three views, let's start looking at some examples of fractures. Here we have a CT scan. I pulled up the axial view, and we're going to start our normal process. Scrolling upwards, I see my inferior border of the mandible, and right away you can see a break in both cortices and a fracture line extending between the two. This is noticed immediately as this is a pretty obvious fracture, so keep in mind, sometimes fractures can be this obvious, or sometimes more subtle. As I'm scrolling through, I can see the fracture lines on both cortices going up and continuing throughout the mandible. To me, this implies that this is a complete through and through fracture through both cortices, and we just have to identify the region. As we know, the midline of our mandible is right here. This is the patient's right side, this is the patient's left side. So this would be diagnosed as a left parasymphyseal fracture. As you get used to CT scans, you'll be able to identify these quickly and realize that this one, for example, is non-displaced. Although we can see a fracture line that extends from the outer cortex to the inner cortex, you can tell that it is a non-displaced fracture because the cortices are still relatively in line with each other. As we'll see in future examples, this isn't always the case. Although we have identified a left parasymphyseal fracture, it's important to remember that our interpretation is not done. We still have to remember to scroll through the rest of the mandible, as we did in the previous video, on both sides, making sure there are no other fractures. In this example, it is an isolated left parasymphyseal fracture, and there are no other fractures to be visualized. Now let's say you saw this fracture, but you weren't completely sure. As mentioned before, it's always good to look at a fracture from two views, not only because it will confirm the fracture, but it'll also give you more information on whether it's displaced and where exactly the fracture is. Scrolling through our coronal view, we immediately want to go to the front of the patient's face. As we scroll into the face, we can see in the mandible a fracture extending here. Once again, in our left parasymphyseal region. It's through and through, from superior to inferior, as well as from the facial to the lingual aspects. Once again, you can appreciate how it's relatively non-displaced. If you weren't sure where exactly to look on your second view, using the 3D cursor is a great tool, as you can click on your fracture line and it will show you on the other side where exactly you're looking. Finally, for completion's sake, if you wanted to also view the scan in the sagittal view, you'd be able to see what this fracture looks like in the sagittal plane. Let's move on to another example of a fracture. Once again, I booted up my axial scan, and I'm scrolling through. At this point, I haven't seen anything, and I can see the junction between the mandible and the maxilla starting. So I'll decide to focus on the right side only, looking all the way back. And as I scroll through, once again, I don't see any obvious fractures as of yet. Coming up the ramus, I'm at the sigmoid notch, following my coronoid first, going back down, and then following my condyle. Doesn't seem to be anything there. So I'll scroll back down to the bottom, where I originally separated, and now I'll follow the patient's left side. Scrolling to the left side, everything seems to be okay. And as I scroll up here, I notice that there seems to be a break in the cortices here. Once again, it's always good to scroll down and up just to make sure, but there definitely seems to be something that's not normal here. Clearly the cortexes are not continuous, and there's a break and slight displacement here. To me, as you're following your anatomy and scrolling up, this seems to be the sigmoid notch, this would be the coronoid, so it seems to be there's a fracture in the area of the left coronoid. I'll keep that in mind and record that on my notepad, and as I go up, I'll follow the condyle now, and I don't see any obvious fractures there. So, as always, I'll pull up another view and see if I can find anything there. So let's pull up my coronal view. And as I start at the front, now I'm focused more on the left side. And as I scroll back, once again, as going from anterior to posterior, you'll hit the coronoid first before the condylar process and the condyle. And I see this break again here. So once again, I'm suspicious of a left coronoid fracture here. Seems to be more towards the base rather than higher up. I'll keep scrolling back, and the condyle looks completely normal. Coronoid fractures are actually a great example in which a sagittal view is very helpful. If we look at our sagittal view here, it becomes very obvious that there's a coronoid fracture. Once again, if you weren't sure of left or right and this was your first time looking at this review, you could go over here to axial, click on the left side of the patient, and it will show the left side of the patient first. Now, let's say you weren't sure if this was a fracture through the base of the coronoid, or perhaps it's just the inferior alveolar nerve canal, like we've seen before, that makes a similar trajectory. There's a couple things that would help you realize that this is definitely a fracture. First off, it is far too high for this to be the lingula, the entrance here, and the inferior alveolar nerve coursing down. Secondly, if you look for the lingula and the inferior alveolar canal, you'll see it down here. Finally, by comparing multiple views, axial, coronal, and sagittal, it becomes very obvious that you have a left coronoid fracture. I want to touch on two more quick examples before leaving you to practice on your own. Pulling up this scan and scrolling backwards, right away, if you're following the cortexes, you'll see a small break in the cortex here. It's very subtle, it's hard to say it's something definite, but as I keep scrolling back, and we go more superiorly in the bone, it becomes more and more obvious that there seems to be a break here involving this tooth. Therefore, I'm suspicious of a fracture in the area of the third molar on the left side, around the angle of the mandible. To confirm this, I'll pull up two views, and after I look at it in the sagittal view as well, once again, you can see a very subtle break in the cortex here, and a fracture here, extending through and through. The reason I bring up this example is although it becomes obvious in multiple views, you can tell that this fracture is more subtle than the previous ones we've seen. That's why it's so important to always be careful to look for these breaks in cortices and look at the fractures from multiple views always. I'd like to finish on our final example with a CT scan that shows more complex mandibular fractures. The importance here is that no matter how complex or drastic the fractures, our approach is exactly the same. Scrolling through the scan, the first thing we'll see is the inferior border of the mandible, and we can notice on the right side a complex comminuted fracture. Although it is quite impressive, we need to make sure we keep our routine, going from bottom to top, one set at a time. Let's begin with the right side. You can see this comminuted fracture of the right body of the mandible with its multiple broken fragments and displaced pieces of bone. Here it is easy to visualize the lingual cortexes and the step off between them as they are not in conjunction and the fracture is displaced. After we have analyzed this fracture, we're able to keep scrolling through the mandible, focusing on the right side to see if there's any other fractures present. As we scroll up the ascending ramus towards our sigmoid notch, first we'll examine our coronoid. Then we'll go back down to our sigmoid notch and look at our condylar neck and then the condyle. I don't see any other fractures, so we'll go back to the bottom and now we'll start looking at the left side. It's important to focus only on the side that you're looking at and not get distracted by the other fractures that you may have already seen. Scrolling through the left side, from the body to the angle to the ramus. At this point, all we're seeing is normal anatomy. But here, around the condylar neck, we see another fracture. However, as per our protocol, first we'll scroll up, we'll look at the coronoid, and we don't see any fractures of the coronoid. So we'll go back down to our sigmoid notch, and as we scroll up, we can see a fracture here of the condylar neck. So at this point we've identified two fractures, however we want to look at them in all three views. First, let's pull up our coronal view. Make sure we're in the bone window. And let's examine that right comminuted body fracture. From the coronal view, once again, you can see how complex and complicated this fracture is. There's multiple broken segments, multiple areas of displacement. It's a grossly comminuted right fracture of the mandibular body. As we scroll back on the right side, we're double checking to make sure we don't see any more fractures in the mandible, including the ramus, coronoid, and condyle. The right side seems clear otherwise. Starting from the front now, and examining the left side, we do see a fracture here that correlates well with what we saw in our axial scan. You can see the condyle here in the fossa. However, at the base of the condylar neck, there's a fracture, and the condylar neck has been displaced laterally. We want to make sure we look at our fractures in the sagittal view as well, to make sure we get an appreciation of both fractures from 3 dimensions. Looking at our right comminuted body of the mandible fracture, you can see once again the displacement on the lingual side, the multiple pieces of bones and fragments, and the multiple fracture lines. In addition, we can now look at that fractured condylar neck, and from a sagittal point of view, it's very easy to see where along the neck of the condyle it's fractured. In this case, closer to the base of the condylar neck, rather than higher up or within the condyle itself. Another thing I'd like to point out in the scan that you may have noticed is when examining these CT scans of intubated patients, you may see the endotracheal tube on your scan. That is represented here, and as you can see, it travels in the trachea into the mouth and outside. You can even see it on the sagittal scan here, as well as its path through the oral cavity and outside the mouth. It's very common to see in severe traumatic injuries a patient that's intubated, and as a result, on the CT scan, you may commonly see an endotracheal tube. That concludes our final example of a mandibular fracture. The main message is that no matter how complex your fractures may be on the CT scan, it's important to take them one by one and follow the same protocol to make sure you don't miss any other fractures.